Hello all. Hair loss has become one of the major concerns which requires an instant action to stop it. Fortunately, hair loss can be restored by an advanced procedure called growth factor centrifuge. This helps in reducing the hair fall, increasing the hair density, and improving the hair quality. Let me take you through this procedure today. So the most important part of doing the procedure is maintaining the sterility. So here I'm gloving up. I'm going to take 20 ml of blood from the patient, transferring this 20 ml blood into 4 different tubes and placing over the rack, and set a timer for 30 minutes. And then here is my important step of the procedure, placing the 4 tubes into the centrifuge machine. Let it centrifuge for about 10 minutes at 3200 rotation per minute. Now let's get back to the patient. So let's begin the procedure with applying numbing cream so that patient feels very comfortable. So every one of us think when you have a hair loss, it could be of this reason or that reason, but here I am to tell you that there are multiple factors like genetic, nutrition deficiency, postpartum means after delivery, and many other factors. So again, the stress could be one of the factors. So I've applied the numbing cream. I'll let it set for like half an hour so that the numbing cream acts for half an hour. This is the procedure. This is the product we've gotten with having the RBCs down, and then this is the platelets which have alpha granules which produce 8 different types of growth factors. For example, vascular endothelial growth factor, platelet growth factor, endothelial growth factor, so many others. So these are the growth factors which I'm going to inject onto the hair root. So once the numbing cream is wiped off, the patient is ready and the scalp is ready to accept the needle prick. So I'm going to wipe off all the numbing cream, and so this is the product which is platelets derived all the growth factors which is going to go into the scalp, and I'm going to inject in a very subtle manner so that the patient is already numbed with the numbing cream. So, and this is the vibrator which helps in distracting the patient so that he or she doesn't feel any anxious. So I'm just gonna take this and start injecting from front. And so I'm going to cover the entire scalp starting from the front to the back end of the scalp. So this part of the scalp is going to be little I'm not going to focus much because men usually do not lose hair this part of the scalp because of the stronger receptors. So my focus is going to be on the crown part. We would definitely require about 5 to 6 sessions minimum. So when do you see the results? From the third session onwards. The first 2 sessions, the work starts beginning from the lower level of the scalp, where the collagen synthesis starts, vascularization, that means the blood supply will start and the hair roots start becoming stronger, and then the all the whatever the changes have to come, it will come on top of the root. So this is something you can go get it done for 1 hour. This procedure is about for 45 minutes, and then after the procedure you can just get back to your work, and this is for monthly once. It's not even so every patient will be thinking, oh, once I just come and get it done, I cannot get back to work, and everyday procedure. This is no, you can just get back to work, and this is still again monthly once and not too expensive. Again, a patient, when they feel that there is a large amount of hair loss, they suddenly start thinking, let's just go for hair transplantation or bigger laser therapies. But this is the procedure which is more friendly and a quick procedure for about 45 minutes. You can just get it done and then get back to your work. And everybody will be thinking it's more painful in terms of being a little convenient and all of that, but definitely not painful. I have not seen any patient of mine jumping off the bed and just running away. So far all my patients have been little being comfortable with this procedure. It's just not for the gender, it's just not for men or women. Any gender can get it done. So men can have because of the genetic hair loss, they would come up with the later stages. So still I would say come up and get your medical treatment along with this procedure done, and then see for 1 year, and then we can take a call. But definitely at the end of 1 year you will see the results from this procedure. The procedure is completed. If you have any kind of questions or queries, please comment below. We'll surely get back to you. Thank you.